Turning 65 is a milestone, but for many Americans, it also means navigating one of the most confusing systems in the country, Medicare. Most people don't understand the basics until they're already at the door. Don't be one of them. Here's what you need to know. Turning 65 opens the door to Medicare, the federal health insurance program for seniors. But here's what surprises most people. Medicare isn't free, and it doesn't cover everything. Understanding the basics now can save you thousands of dollars and prevent expensive mistakes. Let's break down what Medicare actually covers, what it doesn't, and how to avoid the most common pitfalls. Medicare comes in 4 parts, each covering something different. Understanding these parts is the first step to making smart decisions. Part A covers hospital insurance. This includes inpatient hospital stays, skilled nursing facility care, hospice care, and some home health care. Most people get Part A premium-free if they've worked and paid Medicare taxes for at least 10 years. That's the equivalent of working for about 2 years out of your entire career, so almost everyone qualifies. Part B covers medical insurance. This includes doctor visits, outpatient care, preventive services, and medical supplies. Part B has a monthly premium, which most people pay alongside their Part A. The standard Part B premium in 2026 is around $185 per month, though higher income earners pay more. Part C, also called Medicare Advantage, is an alternative to original Medicare. Private insurance companies offer these plans, and they combine Parts A and B, often with additional benefits like dental and vision coverage. Some people like Medicare Advantage because it can be simpler, with one card and one plan covering everything. Others prefer original Medicare because it gives them more flexibility to see any doctor who accepts Medicare. Part D covers prescription drugs. This helps pay for your medications, and it's offered through private insurance plans. Part D plans have their own premiums, deductibles, and copayments. The costs vary significantly between plans, so it's worth comparing options during the enrollment period. What Medicare doesn't cover. This is perhaps the most important thing to understand. Medicare doesn't cover everything, and the gaps can be expensive. Long-term care is the biggest exclusion. Medicare doesn't pay for nursing home care or assisted living. If you need long-term care, you'll need to pay out of pocket or buy separate long-term care insurance. This is one of the most common ways that retirees run out of money. Dental and vision care are also limited under original Medicare. Routine dental checkups, cleanings, and eye exams aren't covered, though some Medicare Advantage plans include these benefits as an add-on. Hearing aids are another gap. Original Medicare doesn't cover hearing aids, though some Advantage plans do. This is significant because hearing aids can cost thousands of dollars and are often needed as we age. When to enroll. Timing matters enormously with Medicare. If you don't enroll when you're first eligible, you could face lifelong penalties that make your coverage more expensive forever. Your initial enrollment period starts 3 months before the month you turn 65 and lasts for 7 months total. If you enroll before your birthday, your coverage starts the first day of your birthday month. If you enroll during or after your birthday month, there's a delay. If you miss this initial enrollment period, you can enroll during the general enrollment period from January 1st through March 31st each year. But here's the catch. Your coverage won't start until July 1st, and you may pay higher premiums for life because of the late enrollment penalty. The exception is if you're still working and have insurance through your employer. In that case, you can delay Medicare enrollment without penalty, but you'll need to enroll within 8 months of when that employer coverage ends. This is called the special enrollment period, and it's important to mark your calendar so you don't miss it. Medigap versus Medicare Advantage. Once you enroll in Parts A and B, you'll need to make another important decision. Should you get a Medigap supplement policy or a Medicare Advantage plan? Medigap policies help pay for the gaps in original Medicare, including deductibles, copayments, and coinsurance. These are standardized and labeled with letters, from Plan A through Plan N. Every insurance company that sells Medigap policies must offer the same benefits for each letter, so the main difference is price and customer service. You pay a monthly premium for the Medigap policy in addition to your Part B premium. But in exchange, you have more predictable costs and can see any doctor who accepts Medicare. Medicare Advantage plans replace original Medicare. Private insurance companies run these plans, and they often include additional benefits like dental, vision, and hearing coverage. But they work differently, with network restrictions and different cost structures. You'll usually pay lower premiums, but may have higher costs when you actually use care. The right choice depends on your specific situation and preferences. Some people prefer the flexibility of Medigap and original Medicare. Others like the all-in-one simplicity of Medicare Advantage, the Part D donut hole. One more thing to know about prescription drug coverage, the donut hole. This was a gap in prescription drug coverage where you paid more once you hit a certain spending threshold before catastrophic coverage kicked in. Thanks to the Affordable Care Act, the donut hole is closing. Now, once you and your plan have spent a certain amount on covered drugs, you pay a lower copayment or coinsurance for the rest of the year. It's not completely gone, but it's much better than it used to be. The biggest lesson is that Medicare decisions aren't one size fits all. Your health, your financial situation, and your preferences all matter. Take time to understand your options, and don't wait until you're 65 to start learning. Medicare is one of the most valuable programs in America, but it's complicated. The more you understand now, the better decisions you'll make when the time comes. If this was helpful, hit that like button and drop a comment below. What's your biggest Medicare question? I'd love to hear what's on your mind. And if you want more content like this, subscribe. I share exactly what I wish I knew so you can make smarter money moves.